After a difficult start to the school year with Covid cases, this school's decided it's time to bring back old measures. Pupils have to wear face coverings in the corridors and communal areas, and they're being told to wipe down surfaces more often. The head's happy, but wants to be able to go even further.
We're doing everything that we can, that we've been asked to do, and our pupils have been great and have followed every instruction that we've asked of them. We couldn't ask anything more of them. It's just that I think there are possibly some more measures, and certainly at a national level, some more support that could help us stopping it ripping through schools.
Data shows that the take-up of vaccines being offered to children is low in England, with only around 25% of 12 to 15-year-olds vaccinated with one dose, compared to around 55% in Scotland and nearly 46% in Wales. That's despite health experts saying vaccines are an important protection.
There's now a new study which is out, which has looked at the impact that vaccinating young people would have on the rest of the population ending up in hospital, dying and getting long COVID. And vaccinating 12 to 16-year-olds or 12 to 15-year-olds would cut the risk of hospital admissions by about 20%, cut the risk of dying by nearly 20%, and cut the risk of COVID by 27%.
As winter approaches, there are ways we can reduce our chances of catching and spreading viruses like Covid-19 and flu.
You may have seen this today, a new government advert encouraging ventilation, especially as we gear up for Christmas gatherings. But that might be a tough sell with temperatures dropping and worries over heating bills. Another line of defence for the government has been the third dose of a vaccine. But David, who lost his father Ivor to Covid, says the booster jab should have been rolled out sooner.
Had the booster programme started earlier, he might have had another level of protection against this disease. Everyone knew at the time that all the people who were vulnerable, who had been vaccinated very early on, that vaccine efficacy had already started to wane. That was known during the summer. So why weren't the most vulnerable like him offered booster jabs earlier?
Less than half of those eligible for a booster jab haven't had it. While experts say the next 10 days are critical to rates among school children, it's also a critical time for all of us to be thinking about measures we might want to take. Anila Dami, 5 News.